Thank you guys for coming tonight. I just wanted to take a minute to talk to you about my lower extremity experience with having care under Dr. Heather. So back in March I fell playing basketball and tore my ACL and meniscus and had to get surgery in May, and I was told that if I didn't get my meniscus fixed right away that it would just keep tearing and then eventually not be repairable. And so Dr. Heather said the day I called her, I was like, I'm sorry, I'm fallen and my knee's all swollen. I was working for her. And she's like, come in right away, like, let's get you adjusted. And I'm kind of thinking, you know, not really putting it together with my knee, but I know chiropractic care takes care of everything. And so I was coming in 3 times a week and up until I had surgery. And then when the surgeon came back into the room after he did surgery, because I was told no walking for 6 weeks, like once we, you know, stitch up the meniscus, you have to be really careful with it. And he comes in, and that's what I was freaking out about too, was 6 weeks of no walking, like on crutches. I have a 5-year-old, how am I going to do this? And he's like, get family, whatever. So he comes in after surgery, I'm like all groggy, and he goes, just so you know, your meniscus healed on its own. He's like, and I didn't have to stitch it up. And I was like, I can walk today. And he's like, yes, you can walk today. And then also aftercare too, Dr. Heather was kind enough to come adjust me in my home, and while I was recuperating, because I couldn't come in here to get on the table, but yeah, awesome stuff, and the knee speaks for itself. So pass it over to you.
Thank you
You're
so
welcome.
much.
Enjoy, guys.
Well, I'm so pleased you're all here, and I guess you got the drift that tonight is all about the lower extremity. And so tonight what we're going to talk about, rather than specific injuries that can occur, random injuries can occur, what I want to really spend time on is the chronic types of concerns that happen. So that's what we're going to dive into today. Anybody here have concerns with the lower extremity, kind of chronic types of things? Yeah. So some of you are here just to be curious and learn, maybe to prevent problems. And that's what I'm going to tell you, is that pretty much everything that we're going to cover tonight, you're going to see it actually could be preventable, and in most cases is actually even correctable. So that's what I want to cover, the solutions behind it. But I want you to understand, because I know that what I've found is when people get a clearer understanding, then they make better decisions. So that's why I want to dive deep into this topic. So this topic is one in a series of our Body Signals program. And last month we did the first part of the FAS syndrome, falling apart syndrome, which was the upper extremity. And so we wanted to follow that with the lower extremity tonight. And I wanted to say something about the title of this, the Body Signals program, because what I find is that many times people have symptoms of different sorts, and they start to name them as conditions. And what I have found is if we can learn to understand the signals that the body is giving us, then we can learn to respond appropriately and get back on track to healing. If we're thinking of it as a condition of some sort, then sometimes we will go down a road to just deal with that one symptom, maybe mask the symptom. That's the dominant model in our culture, is just to mask it. And then we may find that people are feeling better as they're actually getting worse. So when we think of this idea of body signals, I want to really reframe it, that when your body is talking to you, sometimes we don't like it when it's talking to us too much, right? But by paying attention and understanding it, then we can take appropriate steps. So tonight I'm going to actually cover some specifics on what that signaling might mean. And I also like to reframe it because when I think about the different trajectories that people's lives go on, there is a life of probability, and then there's a life of possibility. And the life of probability is if we don't do anything different from the way that we're already doing it, what we can expect. The life of possibility is different from that. And the way that it's different is it's not living by default. It's a choice. It's a choice that you make. It's a decision that you make and a direction that you move in. And I see the first step of that direction towards possibility is to live unconditionally. And I apply that now to the same, we're going to now dive down deep into the subject of the lower extremity concerns, but rather than looking at them as conditions, I want to look at them unconditionally. and I want you to see a different paradigm about them and what's possible. Sound good? All right, so let's jump in. So we're going to go right into the anatomy, and if you understand the anatomy, it'll help you understand the body's functions and the signaling. And really, the whole lower extremity, it all works together. All these joints work together. So we have the lumbar spine, the sacrum, the pelvis, the hip joints are actually right down here, and then we have the leg bones, and then the knees and the feet, where we have two bones on this, the fibula and the tibia here, going right into the feet. Now, most people, when they talk about the hips, because that's part of what we're going to cover tonight, is the hips. When they say the hips, when you think of put your hands on your hips, most people are going right up here. And actually, the hip bone is where the femur goes right into the socket of the pelvis. So it's down here. And so when people talk about, I have pain in my hip, I always have to clarify, which hip is that? And they think I mean right or left, and I mean, do you mean the real hip or the conversational hip? And so we're going to look at it because all of them, we want to cover everything that's involved in this hip area, and we're going to look at that tonight, but I wanted you to understand how it all works. Now, the lower extremity is also considered a closed kinetic chain, and what that means is it's weight-bearing. It's a weight-bearing system of joints. The upper extremity is not weight-bearing, that's an open kinetic chain. So we talked about that in the last workshop, and today we're going to talk about it as a closed chain. Now, if you were doing a handstand, then now the upper extremity becomes a closed kinetic chain, right? So kinetic means movement. So how we move these two extremities is very different. And so let's now look closely now at what happens if there's disturbance in that kinetic chain. Because what we find is somebody could have an injury at some point, like a basketball injury, and they hurt their knee. And then over time, that disturbance of the biomechanics in the knee, it can start to spread through that kinetic chain, and next thing you know, years are going by and you're starting to get falling apart syndrome, where now it's affecting your low back or it's affecting your foot and so on. So these conditions, these concerns can spread if we don't address them properly, because it's all a kinetic chain, it's all one, they're all related. So it oftentimes will start with, maybe actually the most common is an SI joint dysfunction. Whether it's identified or not that way, that's actually the most common thing that starts the whole lower extremity concerns, especially if there wasn't a specific injury to a joint. And so we have the low back pain that can occur, SI joint dysfunction, then we can even have it going down into the hips, and the hips degenerate because of the distortion in the biomechanics. I'll get to you in a second, Tracy. And then we go down, and that can affect chronically, start to affect arthritic knees, and that can lead to ankle problems. And then we have foot pain and bunions and march fractures, which are like stress fractures, and so on. And so it's this chronic cascade of problems that result from something that originated that was correctable. You had a question?
Could you please point to SI joint? Can you please point to that?
We're going to go into
Okay.
deep
Then the
detail on
second
that.
thing is, aren't bunions hereditary?
No, not at all. But the way you move your body, you may have learned from mimicking your parent, and if you're living a similar lifestyle as your parent, then you may have the same results. So if you learn to move your body in the same distorted way that your parent is, then you may see it. But no, they're not. My grandmother had bunions.
They're riddled throughout my family.
Yeah, and I don't have them. You know, did I just get lucky in my genes? Maybe, but I think it's because I have worn more sensible shoes than that was one factor, I'm sure, that contributed to it. And of course there could be a myriad of them. So let's now dive deep into looking at this, and we're going to go right into, oh, by the way, I love this one, because people always think of falling apart syndrome, it's, oh, I'm just getting older. And so you actually can have a different trajectory on what your experience is as you're aging with the lower extremity and with your entire body, but you can't be a sissy about it. Right. All right, so if we go right into this and look at this closed kinetic chain, right? Here's the lumbar spine, here's the sacrum, here's the pelvis, this is the sacroiliac joint right in through here. I mean, I have another picture that's going to be even clearer for you. And then you can see in this dynamic system, you've got the muscles that are moving the bones, and how those bones move in the joint will determine whether they last a long time or whether they deteriorate. And so there's an optimum way of functioning in those joints, the way the joints were designed, which means that they're designed to last a whole lifetime. Don't we find that there are some people that have one bum knee and the other one is doing okay? And what are they told by their doctors? Oh, you just got a bad old knee. It's just a bad old knee. But I'd like to ask you, do you think that that knee took a different number of steps in the lifetime of that person than the other knee? So whenever something is relegated to it's just aging, I always cringe when I hear that. Certainly time is a factor, the chronicity is a factor, but it's not just healthy, normal aging, not at all. All right, so let's dive deep into the top part of this. When we think of the hip, the hip area, it actually there's three types of things that are going on here. The first is this lumbosacral joint right here. So if we look at the lumbosacral joint, actually just a sec. Sarah, could you bring me the spine, please? When we look at this lumbosacral joint here, this is the stack of the spine. So the spine goes all the way up above this. The whole stack of the spine is sitting right on top of the sacrum. And so this L5 lumbar vertebra with the L5 disc right here and the sacrum right here, this is one of the most common trouble areas in the lower spine, is that L5 area.
Did you want the stand? Or?
No, thank you. And so when we look at the stack of bones all sitting right on top, and they're sitting on top of the sacrum. Now, this whole stack of bones has an amazing way design to it, extraordinary design to it. And if we really acknowledge how amazing the body is, we might take better care of it. So this design started when? All the way back when you were one cell, two little cells joined together, one cell, and in that one cell, the brilliance was there. Your awesomeness was there in that one cell. Because then 16 years later, you're taking SATs. And the next thing you know, right, all that brilliance, it's all by design. And so when we look at the design here, we see that all the bones are stacked up and they have these levers on them and the muscles are attached. And when we think of the spine, we think of movement. Look at all the ways that we can move the spine. So we have lots of movement all up here, and then we come all the way down to the sacrum where there's not a lot of movement right down here. This is more stabilizing right down here. And so this interaction, this can take some torsion. Some torsion can happen here. So the discs, they do really well with back and forth and up and down kind of movement, but when they don't really like twist down in through here. And so when we look at what's happening through the spine, we can see the lumbar spine comes down and interfaces with the sacrum. Then remember that the nerves are coming out from the lumbar area, and so if there's any compromising in this area, those nerves are the ones that are going down into the legs, allowing our legs to heal and function. These nerves that come out, they're also in charge of the bowels and the bladder and the reproductive organs. So if we have disturbance in through here, it can start to affect our health as well. When there is that disturbance in here, it also can lead to start to show up into degenerative change, so where the bones themselves start to deteriorate. And that's again when the biomechanics is disturbed. Now, as I go through all this, again, it reminds me of this day when I went to the Echo Center a few years ago, and they had the body exhibit. Did anybody see that?
Yeah, I went with you.
Oh yeah, you went. Okay, great. So what happened was, this body exhibit is where they dissect out all these different body parts from real people and horses and animals, and then it's all presented there so you can go and look at it. You know, when I was a chiropractic student, we dissected cadavers, but that was the only encounter I had with that. And here they have this amazing exhibit that you can go to see. So I went to see it, and I was just in reverie of the amazing body I was looking at and how it all worked. And while I was touring it by myself, they happened to have medical doctors from UVM come in to lead tours. And I happened to be there at the time when they were doing a tour on the lower extremity. And so what they're talking about is they go up and they're pointing to, right, and then this is where the knee is, and this is where the knee breaks down. And this is how it gets all broken, and this is how we fix it. And then he talks about the surgery that they do. And then they talk about, and this is where the hip joint breaks down. And they just kept talking about how the body's just going to break down. And this is just where it's going to break down. That's what they kept going over and over with. And I'm thinking, no, stop, no, it doesn't have to be that way. And so I just decided, I want to lead a tour. I want to lead it my way. And so I asked them, and they said, sure, just bring a group in, you can lead a tour. And so I invited members of the practice to come, and I went around and pointed out, this is how amazing it's designed, and how it can heal itself, and it's self-healing, and it's self-organizing. And people that were in the museum, like, jumped into the tour as well. And at the end, I got a tip from somebody from the tour. But the thing about it was, again, it's the paradigm about it. Like, if I talk to you tonight about this, please don't think, oh, it's that normal aging. There's definitely a cause behind it. And if we can uncover the cause and address that, we can correct it and we can prevent it. So that's the importance of why I want to spend time with these topics. Okay, so here's the sacroiliac right here. This is the sacroiliac. So here's the sacrum, here's the pelvis or the ilium, and here's the sacroiliac joint. And here is if the sacroiliac joint gets inflamed, we could call it sacroiliitis. Now, whenever you're walking, your lumbar spine is actually going up and down, up and down. And when that happens, the disc is pumped. And as the disc gets pumped, that's how it brings fluid in and gets rid of toxins. It doesn't have a rich blood supply, so the way that we feed the disc is through movement. And that's called imbibition, where we are sucking fluid in and pushing toxins out. And whenever you walk, that's what's happening, right? Up and down the lumbar spine. When you're walking with the sacroiliac joint, it's doing something different. It's actually shaped. It's called an auricular surface. It's shaped like an ear. So this joint right here moves like a figure 8. So when your SI joints are moving when you're walking, it's moving in a figure 8. So as you're walking, sacrum and hips are doing this figure 8 motion. And then we get down to the femur head. So the head of your thigh bone fits right in here. And if you, let's just get some anatomy here on yourselves. So if you were to put your hand on the back of your spine, or you could feel somebody else's spine next to you if you're brave, right? So the bumps right here on the back of the spine, those are the spinous processes that come off of the lumbar spine. If you go to the dimples, everybody has these. It doesn't matter how much adipose tissue exists, everybody has the dimples here, and that's the SI joints right there. When you have chronic SI instability, sometimes you'll feel little floating nodules in those dimple areas. That's one of the signs of chronic sacroiliac instability. The ligaments calcify in there. And then if you go right down to the tip of, here's the broad sacrum, and the sacrum, you go right down to the bottom, that's the tip of the tailbone, that's your coccyx, the tailbone, coccyx. And now if we go right to the sides of our hips, there's another kind of a dimple place here. Where the bone is, that's your trochanter. So that's where the hip bone, which is really the femur head, the leg of the femur, fits right into this socket right here. This is one of the strongest joints in the body, is this hip and socket right here, with the femur head going in there. So that's right in this area, right in here. And so when you're walking, what motion are your legs doing? Your legs are going back and forth, back and forth. So think of this as a whole kinetic dance that's happening, and if everything is doing its job, the lumbars are going up and down, the sacroiliac is going in the figure 8, and the legs are going back and forth, then that's a gait pattern that you have, and that would be an optimum gait pattern. Let's say that you slip and fall on the ice and land on your hip. And here we are in Vermont. How many people have ever done that, right? Or you slip and fall and land on your tailbone, right? And so when that happens and it jars things out of place, you might start to get inflammation of the soft tissue and your body is going to try and protect that. So what is it going to do with those muscles that usually are getting your bones to move? It's going to change the function of movement, and it's going to lock it down. It's going to strap down those joints. So the primary job of muscles is to move the bones and the joints. The secondary job is to strap them down, to protect them, to stop them from moving. So when you injure yourself and you feel a spasm, that's your body, your smart body, locking it down, bracing you to stop you from further injury. And if you have a misalignment, that may start to irritate the nerves. You may lock it down to try and minimize the amount of irritation to the nerves. The more inflammation that occurs, the more it may lock it down. And now, here's something that happens is, as it's trying to protect that, it creates more and locks it down. It may start to create more inflammation if you keep moving in a distorted gait pattern, right? So if those SI joints are supposed to be doing that figure 8 movement, and one side locks down, now as you're walking, you're going to start to walk in a waddle. And as you start to walk in a waddle, we're going to start to see torsion in the lumbar area, because the sacrum, instead of doing its figure 8 and the sacrum kind of staying where it is, the sacrum now is going to have a kink to it where there's going to be starting to have some torsion. And then what's the first disc level that's going to be exposed to that torsion? Yep, it's going to be that L5, and L5 is the most common disc to be compromised when we have this loss of proper biomechanical function. So when we want to definitely identify what's the primary subluxation, the lumbars may be a secondary subluxation. So that when you have that misalignment of the joint where it's affecting the nervous system, that's what we call subluxation. All right? And so when we have this SI instability, that's actually much more common and often gets missed. And that's one of the things I love to discover if it's there, because then if we address that and we restore that proper motion, then we start to see the whole rest of the body, the motion starts to be restored as well.
Where's the psoas?
The psoas runs from the front of, actually it's around the front side area here of the lumbar vertebrae, and then it comes right down like this, and it attaches to the femur head.
So it's very short.
Well, it goes up to the lumbars, it goes all the way
goes
from
up
here to the
further?
lumbars.
Okay.
Yeah, so we have lumbar 5, 4, there's 3, 2, and 1.
Okay.
So yeah, it goes all, and the psoas acts as guide wires. So, you know, when you think of guide wires, they're not big, robust things, they're just little things that just kind of act as stabilizers. That's their job, is just to be stabilizers. But if you have an instability and one side gets locked up, now
So it's not a muscle?
it is a muscle.
Oh, it is muscle.
It's a muscle, but it's not like a quadricep muscle. It's not like a hamstring or a glute muscle, those strong muscles in the body. It's a guide wire muscle, and yet it will be recruited to act like a more substantial muscle if the sacroiliac is unstable. Okay. All right. So when there is a subluxation, something gets jarred out of alignment from a macro trauma or a micro trauma. So a micro trauma might be if you're always sitting with your legs crossed. It might be from poor posture. It could be from certain sports activities that you're doing repetitively. When you have the subluxation, you have the joint misalignment, which then results in the soft tissue damage. That then will lead to inflammation of that soft tissue, which then is going to be associated with nerve irritation from the inflammation in the area of the nerve. Then, of course, we're going to have that muscle spasm that locks it down, right? Is our body smart or stupid?
You're smart.
We all agree our bodies are smart, right? And so when we have that muscle spasm, that's a smart thing to do because it's trying to protect you. And what is the conventional approach when people have I got hip problems or knee problems? The conventional approach is to get muscle relaxers and painkillers. And when that happens, you're now saying, body, you are not smart. We're going to override that and we're going to force that muscle to relax. And now as the muscle's relaxing, it actually can't protect you anymore. And then if you're taking the painkillers, then you're not getting the cues of which motions are actually causing more damage or injuring you more. You've lost those cues now. So that's that typical situation where you are feeling better as you're getting worse.
So is that also would you even recommend anti-inflammatories? Like, because anti-inflammatories generally are connected to pain, right? So, or pain is connected to inflammation.
Well, I'm never going to be the one, because I'm not a medical doctor,
Yeah.
so I'm not coming from that paradigm, and I'm not going to recommend medication. Is there ever a reason why you might use a medication? Sure, there may be. Is the use of medications to address these concerns way overused? Absolutely. So there are natural ways to address inflammation, so I'd always want to go in that direction. And we're going to talk about some things to do for self-care as well. The muscle spasm is when that locks down. Remember the word imbibition for the discs. So now the discs are no longer getting nutrients in because they're locked down. We're not getting the pumping motion anymore. They're locked down, they're not getting nutrients in, and they're not getting toxins out. And then that leads to more and more joint fixation and degeneration, and that's what then results in the arthritis. So when we hear people talking about, oh, I've just got arthritis, and osteoarthritis, degenerative arthritis, sometimes people will say it as though, oh, it's just arthritis, as though, oh, it's just aging. But if we understand what the cause of it is, right, we can go further upstream from there.
Is that why they say movement helps with arthritis, because it pumps the stuff, keeps things moving again?
Yes, exactly, yeah. And that word movement, I just love that word movement. Movement equals life. When we're moving, we're alive. When we stop moving, we're dying. So when you stop moving an area, that area is dying, it's deteriorating. So at all costs, we want to do it safely, but we want to be restoring movement. And if we allow the body to give us the clues and the cues, the body signals of that's not the right movement, if we're tuned in, our body will give us that cue. That's why we don't want to mask that. All right, and so how do we correct subluxations? Adjustments in rhythm, right? Healing happens in rhythm, so we want to really look at the patterning of those subluxation complexes, and we want to address it in a rhythm. And we want to have people break the bad habits, stop crossing that leg, right? Stop sleeping in that twisted way, and so on. And then we want to do exercises to strengthen the joints, to strengthen the spine, and to strengthen that suit of armor that's protecting our nervous system. So how do you know if you have subluxations? We have 5 criteria that we use, and I use 4 of them commonly in the office, and the 5th is available when I need it. Instrumentation, so you've been through the scans. Those tell me exactly the nature of the type of nerve interference, where there's inflammation, where there's spasming in the muscles. It gives me all that information. The motion palpations, where we're feeling the movement in the joint, so literally feeling where is it locked up. And the other motion that I want to test is the tone in the nervous system. So when I do the leg checks and I'm monitoring how much tension is there in the heel cords, that's actually telling me about the amount of tension that's in the spine. And it literally can help me zero right into what part of the spine is holding that tension pattern in that moment. I also look at the leg lengths, and we look at if there's a discrepancy, because that tells me where the twist is in the pelvis and in other parts of the spine. We also do static palpation, just feeling the bones themselves and feeling where there's inflammation. If I were to give you an apple and I had you close your eyes and I said find where the bruise is, you could find it. So that's what we're feeling for, is where are the bruises, where there's inflammation, where is that going on in the body, where there's overload and injury. And then X-ray can be used, again, to look at alignment, to look at if there's any fractures and that sort of thing. And then there's this one called visualization. So visualization is one that I use quite often, and that's looking at the posture and looking at the dynamic biomechanics of that person. So would anybody like to be a volunteer so we can, okay, come on up. All right.
I don't know what I'm doing wrong.
All right, so you're going to stand just like this.
Okay.
All right?
Okay.
And so if you guys looking from behind, you're just going to look straight ahead. And we're going to just start by understanding that, of course, a healthy body is a balanced body, right? If you're balanced, you're healthy. So we want to then look at the different planes here. And we look at the plane of the head, the plane of the shoulders, the plane of the hips. And we want them to be level. And if they're not level, then that's going to be a sign that there could be some distortion. So Jackson, you're kind of the most behind her, directly behind her. So if I put my hands up right here, can you see which, if either of them looks uneven?
The right side's higher.
Yeah, exactly. Yeah.
I have not been adjusted this week.
That's right, there you go. Okay, and now let's look at the shoulders. And what do you see with the shoulders?
Same thing.
Yeah, exactly. Okay, and then if we look at the hips,
Same thing.
yeah. Okay, so when I see that, when I see right, that's often an indicator that the primary subluxation distortion is at the bottom of the spine. If I saw right, left, then it may be that this is compensating for something that's happening upper cervically. Right? So, but that posture, that tells me something. Then I can also look at the SI joints themselves, and I can look at the gluteal muscles, and I can see, like in hers, what I can see right here is this is kind of coming out, and this is flattened down. And so that tells me that there may be a little flare to the pelvis, to the right side where it's actually torquing in, and then the left side is torquing out. So there's a rotation that's happening there. And that tells me, okay, if that's happening, then I'm going to look down at her feet, and oh, what do I see? I see that right foot is flared out. So that makes sense that that's actually coming from the pelvis. Do you see how this works? So I'm just working through the whole kinetic chain. And so if somebody were to walk around all the time like this and they weren't getting adjusted, they weren't having anybody check their nervous system, what do you think if they had a little extra stress in this kinetic chain? Like we might see, oh, now the knee has blown out. Like, oh, I tried to start exercising and my knee blew out. Do you see how that works? So what if we could actually prevent that from ever happening by bringing more balance into the system? Does that make sense? All right, thank you so much. Yay! All right. So when we have the SI dysfunction, sometimes that can go up into the lumbar spine, and we can see degeneration, deterioration in the lumbar spine. And then sometimes it can deflect down into and affect the hip joints, so that as you're walking, the hip joints are not moving in alignment, and it starts to grind in that joint. So even that strongest joint of the body can break down. And so when that breaks down to enough of a degree, we then have these hip replacements that can happen. So interesting that, sometimes people by the time they get to me, it's too late. There's so much deterioration there. And when it gets to the point where it is actually affecting that person's quality of life, where they just aren't moving because it's just too painful, it's just hurting all the time in there. It doesn't go away no matter what you do, and it's getting in the way of them moving, then the hip replacement is probably going to be a really good idea for that person, because they're going to get their quality of life back. And then once they have that hip replacement, the really important thing is to start to now work those muscles in that joint to get it as healthy as possible. So that joint is actually designed for that person to be able to do full ranges of motion, but they still have to do it properly. What do you think would happen if the old habits that they had that caused the deterioration in that one hip, if they don't address that, what do you think is going to happen over time?
Deteriorate again.
Yeah, this hip won't deteriorate. It's fake, right? We're not going to have any degenerative change in that, because that's a piece of metal. Yeah.
Okay.
Yeah.
But don't those wear out too?
Well, sure, of course, yeah, and they have a lifespan to them as well. But my point is that the other hip is going to deteriorate. You see, but what if you were able to restore proper function? You could actually prevent that other one from having to go through that deterioration process. Yeah. And then we move down into the knees, and so I want to show you the knee here, and we're going to also talk about self-care with all this too. So the knee has this femur, and then it has the tibia coming up, and you can't see on the other side is the fibula, and here's the patella right here. So if we look at the knee, one of the major things here is that you have this quadricep muscle. It's 4 layers of muscle, and those 4 layers, they all have different tone to them. And they all have nerve supply that's controlling them. And so can you imagine, like when you contract that muscle, that's when you're moving that leg, you contract the muscle, and all those muscles are attaching to that patella, and the patella then it acts as an anchor for those muscles, and it acts as an anchor for the muscles coming up here, and it protects the knee joint, the patella does. So if you were to have distorted, disturbed, altered tone in these muscles, then as you're moving that muscle, it's going to start to torque and move that patella out of alignment. And that irritation, then you're going to get swelling underneath it, and so sometimes people will complain about pain like right underneath here, right in here. And so that's often a sign that there's something going haywire with the quadriceps that needs to be addressed. So that could be from the nerve supply to the quadriceps that's distorted, that's affecting the tone of the quadriceps, one particular layer of that muscle. So that would be an important thing to address. But also what can happen is in the tone of those muscles, you can get fibrotic and scar tissue in those muscles from injuries from the past, and then from distorted movement that is actually not healthy for the muscle, and it builds up this fibrous adhesions. And so there's ways that you can actually work with that. So we're going to talk about self-care now for the whole system. And foam rolling is a tool that can be used. Has anybody here used a foam roller? Yeah, some of you have, yeah. And there's another way you can address it as well. So the foam roller is something that you lie on, and you use it as a way of just digging right into the fibrotic aspects of the muscle. And it's not a comfortable experience at all. You have to be committed to it. But another simple way to do it would be if you were to just have skin and put some oil on your skin and be sitting down, either in a chair or sitting, kneeling, and then you put some oil on your arm, and you can dig right into that muscle. And when you find the parts that hurt, you contract, and then you relax the muscle, and you just hold it and dig right in. And then you go down a few more inches, and you find that one. And you just find the places that are tender, and you're just digging in there and holding it. So it's kind of a self-foam roller. It's a trigger point type of approach is what you're doing. And you can go right down your whole leg as you do that.
Why is it called foam rolling?
There's a tool you use. It's like a pillow. Actually, let me just grab that foam roller. Hang on.
Because I've got like a bowl that I use.
Yeah, I've seen people before. Yeah,
I use a bowl, and
yeah,
I used to use a wooden spoon.
yeah, I've seen that.
It's just like pressure, it's just trigger points and that
Yeah.
kind of stuff.
I can't make myself do it to myself, but I can pay somebody to do it to me.
All right.
Good one.
So here's the foam roller. So the way that I don't know if you'll be able to see it, but the way you would use it is, for example, if I was working with the quads, you get right on the beginning of the part of the muscle that's closest to the spine. And you lay down on it, you let your weight come on it, kind of flex, you tighten up a little bit, and then you just relax onto it. And you might relax onto it for 30 seconds or so. And then you're going to move down 4 to 6 inches with the weight of your body going against that foam roller. And then you relax down it. You contract it and you relax down into it. And you're going to look for the places that are tender as you do it. So you can do the thigh, you can go onto your side, and you can do your IT bands, and so on. So you can just use this as a way to get into the different parts of the muscle. Another thing you could do is take a tennis ball, and you could actually...
I have like a rubber ball.
Yeah, and you can lie on that, and that's a good way to work with the gluteal areas, kind of like a trigger point type of thing. And you're just looking for the tender spots. That's your body signal. And you're just going to relax right onto them. And that's a way to really soften up the tissue.
They had me do that with my shoulder too, during the whatever. Yeah.
Yeah. So you can just go for it. Like, you can just explore and investigate your body and what are the signals that it's going to give you, just as you use the foam roller or a tennis ball. Under the bottom of your foot, a golf ball will serve that purpose too. So those are some tools for self-care. Ice would be another way to address inflammation. So you really want to pack those joints with ice. Really surround them. Let that cold get deeply in for 20 minutes and then off for 20 minutes. So on and then off. And that function of going on and off acts as a pumping mechanism of contracting and dilating the blood vessels. And that's the way we get that excess fluid out and address the inflammation. Very healthy way to do that. Okay, and then next, here's that beautiful picture of the patella right here. And so you can imagine, this is an x-ray, so we're seeing the bones, but the muscles are attached to those bones. And inflammation can occur right underneath that kneecap. So then exercise. So I want to talk about some exercises that can be done for the lower extremity as well. And there's, there's lots of finesse and refinement, but I know that if we can just do the basics in a good way, then that actually can help everything. So one of my favorite exercises is squatting. So our bodies were designed to squat. And how do I know that? Try going out in the woods and pooping without squatting. Hard to do, right? Yeah. So we were designed to be squatting every day, every time that we pooped, right? We were designed to squat just to hang out and to eat. Like, that's what our body was designed for, is that when we want to take a rest, to squat down.
Waiting for the bus.
Waiting for the bus, yeah.
Having a smoke.
Yeah.
You see that Asian, a lot of Vietnamese people sitting waiting for the bus having a smoke.
So in some countries, we still have that. I actually lived in South Korea for a number of years, and China, and their toilets are pit toilets. You stand on them and you squat. So it's fantastic because it really helps to maintain that healthy, normal design. There is one type of individual in the American culture that's really good at squatting. It's a certain athlete. Catcher, yep. And if you watch those catchers, they're not going to last very long if they're not excellent with their squatting. Yeah. So learning to squat properly is a beautiful thing to do for your entire lower extremity, as well as your hip joints, as well as your sacroiliac and your lumbar spine. But you have to do it properly. And we, by design, we already know how to do it properly. We started that way, but then something got in the way. And it's exactly what you're all doing right now. Sitting in chairs, right? Ever since we introduced chairs in our children, as soon as they're put in chairs, and now more than ever, they're in buckets from the very beginning, right? Yeah. So allowing kids to just move naturally and not having them spend a lot of time in chairs, letting them squat, is one of the best things you can do for their spine and their lower extremity. So if you look at the proper way to squat, right? The knees are over and tracking the toes. The knees are apart. The feet are shoulder width and are flat, and the weight is on the heels. There's this big chest. The torso is upright. The hips are below the knee. You see that? And the body's in balance. The back is straight and solid. It's not rounded forward. And the head is upright so you can look forward and you're relaxed in this process. So we want to be thinking about all those things as you're starting to do your squats. And there's a whole sequence you can go through, so that if you can't get right into a squat from the very beginning, then you want to just learn how to do it one step at a time. This is an example of somebody who is doing an improper squat, demonstrating it, and then doing it properly. So improperly, the knees are together. You can't see it so well, but his low back is curved. His head is tucked down. So you want to avoid those things. So when you're doing your squat, feet are wide apart, shoulder width apart, and then as you're going down, just your arms can be out in front to counterbalance. And as you go down, you're going to be lifting that tailbone up as you come down, and the weight's going to be on the heels. Get the sit bones down below the knees, and as you're doing this, you want your knees to be going wide, and you want your feet to be spreading the carpet apart. So that's how you can get a lot more stability as you're doing your squat. And so you can go down, wide, and then up again. And you can be there just briefly and then come back up again. If that's difficult for you to do, just start by going onto a chair. So you're just going to push your feet apart, push the knees apart, lift that tailbone up, and then you're just sitting on a chair. That's the beginning of learning how to squat. And then you can do gradations of going lower and lower and lower until you're not using any brace at all. You're just being able to do your squats yourself. And so those are the self-care things, and then there's the professional care. So there's lots of useful things out there. Chiropractic, ART I'm going to talk about, massage therapy, physical therapy, and MDs. So MDs, they certainly have a place. You know, if you go and you're skiing and you blow out your meniscus or you blow out your ACL, right? Great to have that emergency team that can put you back together. When it comes to the chronic concerns, though, where the tools that are used are masking the pain and undermining that muscle strapping mechanism that is trying to protect you, then I think that's where things start to go wrong. And we can start to actually, we can propel people into the chronic degenerative states by not addressing it. Injections and that sort of thing, they may provide some relief, but over time I'm not a big fan of them because they turn out not to be so successful in the long run. PTs, physical therapists, are fantastic for teaching you exercises that you can do for rehab. Awesome tool to use. Massage therapists, again, trigger point therapists, and they're in there to work with the tissues, with the muscles of the deep tissues. ART is active release technique. It's another technique to get right into the scar tissue that can build up in muscles. And then chiropractic. So let's look at that idea of chiropractic and specifically the areas that I find most commonly are associated with the lower extremity concerns. So as we said, it's the sacrum and the SI joint is a big one. That's the primary one that I find. And then L3 to L5, that's where the nerve supply comes out and it goes right down into the legs, all the way down into the feet. C1 is another one that I commonly do find with lower extremity concerns. So I'm always going to make sure I look there. And there's some interesting research where they found that people that get head injuries, concussions, that they actually have an increase in ACL injuries in the knee. Is an increased risk of ACL injuries. So athletes that receive a head injury, a concussion, they don't know that their career or their scholarship, or their, wherever they want to head with their sport, that if they don't actually address the distortions in the upper cervical spine and the how to address properly the healing of the brain, then they actually are setting themselves up for a greater risk of ACL and knee injuries. And why would that be? Remember when we did the posture analysis with her and we saw, the head was tipped a bit. That tells us that the righting reflex, the brain's perception of where the body is in space, is wronging them, right? That righting reflex is wronging them because it's not actually tracking appropriately and accurately where the body is in space. So you take that distortion and now you add something in a sport where you're moving fast and twisting and the brain actually doesn't, the body isn't exactly where the brain thinks the body is, and that's where you then overstress the joint and you blow it out. So it's so interesting, and I do find that I better make sure that upper cervical area is clear whenever somebody is coming in and they have a body signal that includes a lower extremity concern. And then, there are times that I'm going to look right at the joints themselves, but I often find if someone is complaining of the knee, that I'll want to check and see if I need to adjust the foot or the hip, as well as coming out of the nerves coming out of the spine as well. And if someone has trouble with the hip, I'm going to look at the knee and so on, because it's all part of that kinetic chain. And then the other thing I wanted to mention was, again, with inflammation, we want to look at the whole diet style and lifestyle. So again, we come back to correcting the subluxation. It's that three-legged stool. So adjustments in a rhythm, breaking the bad habits. That means looking at, is there something, like, are they not doing their squats properly, or maybe not at all? So that's one of the habits we want to break, and we want to introduce that in a healthy way. And then exercises to strengthen the spine. Other bad habits, that's going to be all about how you eat, how you think, and how you move. So training the body how to move properly. And you could use professionals like Pilates or yoga or CrossFit. Those are great tools to use in our community of training you how to use your body in those healthy ways, how to move your body in healthy ways. And then if we look at the diet, we want to look at an anti-inflammatory diet. So if you've already got irritation and inflammation in a joint, spine, hip, knee, ankles, feet, and then you keep putting inflammatory foods into your body, then you just keep reinforcing that.
Mm-hmm.
So that would be another part of care, is remove the things that are recreating the pattern, and then also look at, are there foods that are anti-inflammatory? And there are. So just load up your plate with the anti-inflammatory foods. Or actually get some tissue-specific supplements, boswellia, frankincense, turmeric. Everybody's heard of curcumin, right? That has those wonderful anti-inflammatory benefits. So adding those things in. And then there are even some tissue-specific nutrients, like how to rebuild the soft tissue, how to rebuild that connective tissue. So we look at that as well as part of our care for folks. And so again, we just come back to this idea of looking at body signals. So our next body signal talk is going to be next month, and we're going to focus on the neck, because that's a big one that people often have concerns about. So we'll dive deep into that one as well. And that is our program for tonight. So I thank you so much for your time and attention. I actually have a couple of articles that I'd like to send you home with as well. And one is looking at a piriformis stretch. So that's a really good one for the hip area. And that can even contribute to sciatica, the pain going down the legs. So it's going to show you a bunch of different stretches you can do for the piriformis. And then one other article that just shows the effect of the feet and having the feet lined up, and how that can relate to the other joints as well. So using orthotics or custom-made inserts in your shoes to make sure the feet are healthy, that also can help the rest of the spine be healthy as well. And so we do those scans, as you know, right here in the office to take a look at the feet as well. So I thank you so much for your time and attention. If you have any other questions, I'm happy to answer them.
What about weight gain? Because I've gained a lot of weight this winter. I mean, first of all, it was a really bad ski season. But second of all, I was kind of preoccupied. And so I sat for 4 months and did not move, essentially. And, you know, so I know I've gained a lot of weight. And I'm wondering, you know, as I'm now, like, trying to get fit again and everything else like that, I'm wondering, you know, how much of the aches and pains am I feeling are because, okay, one, I'm weak, but two, I've put on 20 plus pounds onto my skeleton already.
Yeah. My answer to that question is you could have someone that's very, very muscular that has 20 pounds more of muscle. Mm-hmm. And so we know that when we put on weight and it's fat that we're putting on rather than muscle, mm-hmm. that it's a sign that we're probably putting our bodies into more of an inflammatory state. So it may be more that you're just in a more inflammatory state. Being sedentary also contributes to more inflammation. Mm-hmm. And the other thing I would say is a joint that is used in a healthy way and has a good nerve supply can withstand a lot more weight. Mm-hmm. But if you have a distortion in how the biomechanics of that joint, the extra weight will amplify the deterioration.
Because one thing I noticed that, you know, I go in like this, kind of from the...
With your knees.
Yeah.
The valgus, yeah.
So, and that's become really pronounced in the last few months.
Oh, yeah.
I know that, you know, that's sort of...
So I would recommend the squats as the first thing you start to do.
I do. I love that position.
Just make sure that...
I'm doing it right.
Make sure that you are following that idea of you're gonna be pushing out with the knees and having the feet like rip the carpet apart. You wanna that's how much grip you want to be as you're doing your squat. And when you start to do that, you're gonna develop these
Well,
lateral
that's
muscles.
like chair position, but then like in yoga it's called chair.
Yeah,
So,
yeah.
and then, but
But I'd like you to go, I don't know if
I
the
go,
way,
I go straight down. Like,
yeah,
And I'm just like I came back from walking today, and before I got in the car and drove away, I just sat there for like a few minutes.
yeah.
Because it just, it feels really good.
Yeah,
I
yeah.
just squat down.
Yep, so we can also check to see, to make
And I
sure.
was wearing a skirt, so I was afraid that everyone thought I was probably in the back garden doing something else. But I wasn't.
So we can also just check to make sure all the muscles are turned on, up and down the leg, that they're getting that proper feedback between the brain and the nerves carrying those messages back and forth. We'll check that too. Any other questions? I thank you so much for your time and attention. We're going to have a recording of this, and we'll get it up either on the website or on our YouTube channel. So if you valued this and you know other people that would benefit from this, then of course please share it with them, and we'd be happy to help. Thanks so much.
Thank you.